Hello everyone, this is April. Welcome to my channel. On this channel, I'm gonna share my nursing study notes, my study tips to help you survive nursing school and pass NCLEX. Today's topic gonna focus on the heart failure and pulmonary circulation. I noticed that a lot of people struggled with the difference between the right heart failure and left heart failure, and I understand that the symptoms are very different, but if we understand what is the pulmonary circulation, how does the bloodstream works transferred in our body, it is very easy for us to understand that, to distinguish the difference between the right heart failure and the left heart failure. So let's briefly review the pulmonary circulation very quickly. So the red color means the oxygenated blood. I will use O2 blood to write down here. And the blue color means the deoxygenated blood. DO2 blood, I write down here. And the artery is the tube for heart to pump out the blood. And the vein is the tube for heart to receive the blood. So you can see that the difference between the artery and the vein, they are nothing to do with the oxygen. I noticed that a lot of people think that the artery carries the oxygenated blood and the vein carries the deoxygenated blood, which is not true. Like the pulmonary artery is still the deoxygenated blood, and the pulmonary vein is actually the oxygenated blood. So don't get confused with that. So the deoxygenated blood, oh, by the way, this is my heart, my right heart, and this is my lung, and this is my left heart. The reason I put the heart and lung like this, because I'm not good at drawing. I'm not going to pretend I'm an artist. So, okay, let's start. The deoxygenated blood from the inferior vena cava and superior vena cava, which come from our body, they will go to the right atrium, then they go to the right ventricle, then they will pump out from our right heart to the lungs through the pulmonary artery. It's still deoxygenated blood. When they arrive to the lung, they do the CO2-O2 exchange here in the lung, and then they become the fresh oxygenated blood. They go through the pulmonary vein, they go to our left atrium. From the left atrium, they go to the left ventricle, and from the left ventricle, they will pump out to our body to meet the oxygen demand. So after we understand how the pulmonary circulation works out in our body, well, it is very easy for us to understand the right heart failure and the left heart failure. So first of all, what is heart failure? Heart failure is the heart muscle, they fail to pump out the blood to help to meet the oxygen supply in our body. So typically we have the right heart failure and left heart failure here. And if so first of all, let's talk about the right heart failure. If the blood coming from our body went to the right heart, and if the right heart didn't work out, where will the blood go? They're gonna go back to our body. If they stuck in our body, we will have increased the peripheral venous pressure. And if you remember this, you're gonna automatically think about all those following symptoms. First, if the blood stuck in your body, stuck in your veins, you're gonna have distended jugular vein. It's very easy to understand, right? And then if the blood stuck in your body, you have like overloaded blood went back to the liver and spleen, they're gonna damage the liver and spleen. If you have a damaged liver, you're gonna have ascites. And of course, all those blood stuck in your vein, you're gonna have edema. And of course, all those extra fluid in your body, you're gonna have weight gain. And the red flag here is 2 pounds per day. And all those extra fluid, all those extra load in your body, it will cause fatigue, right? Then let's talk about the left heart failure. So We know that the blood from the lung, the oxygenated blood from the lung to the left heart, go out to our body. So if the blood cannot go through the left heart, where will the blood go? They will went back to the lung. All those blood stuck in our lung. So we will have increased the pulmonary capillary wedge pressure, and of course we will have the pulmonary congestion, means all those blood stuck in our lung. And if you remember this, you're gonna remember all those symptoms. Think about that. You're gonna cough, you're gonna cracker, you have all those wheezing, blood thinning spectrum, because the blood's the pressure is so high here. The blood went to the mucus and you want to cough them out, so you will have blood thinning spectrum. And because the pressure in your lung is so high, when you lay down, all those blood push more to your lung, so your lung is more congested. So you will have dyspnea when you lay down. This is called osteopenia. And if you want to catch more oxygen, catch more breath, you will have tachypnea. You want to breathe more quickly. And when you fall asleep 1 or 2 hours later, you may wake up because of the shortness breath. That's called the paroxysmal nocturnal dyspnea. And when you exercise, you also have shortness breath because you increase the oxygen demand in your body. So you will have external dyspnea. And due to the low oxygen supply, you will have confusion and restlessness. After we talk about the pulmonary circulation, you will understand the difference between the right heart failure, that all those symptoms caused by the increased peripheral venous pressure, and the left heart failure, all those symptoms caused by the increased pulmonary capillary wedge pressure. And if you understand this, you will automatically remember all the following symptoms and understand the difference between these two. And that's all about today's lecture. And if you like it, please thumb up and share it to more people. And if you want, please leave a comment to talk about how you feel about the heart failure and how you want to study about the heart failure. Or you have other topics that you want me to talk about. Thanks for watching. See you next time. Bye.